Welcome back. Dog Hobby 2020 made some polls to answer. They pop up on top right of your screen as you proceed with the video. Please participate. I know few people just click the video for social message. They can go straight to last 2 minutes. Others stay with me. Before going to the topic, our favorite line, no medication without doctor's prescription. And our topic for the day is impetigo. When it comes to impetigo, it is predominantly Staphylococcus, isolated from the site of infection, but infection can be caused by Streptococcus. Then why is it Staphylococcus that is mostly isolated? It is because Staphylococcus produces toxin against Streptococcus, replacing Streptococcus. Let us jump into case scenario. Here we have a 6-year-old child studying first standard in a school at Rentachintala. It is a place in Guntur district and is always hot and humid. And to those who are asking where I live, I can assure you my permanent residence is in Guntur district, Andhra Pradesh, India. She came with crust on the face. She is alert, playful and very talkative. Our doctor was surprised by her perfect history. From history, what she meant was rash followed by pustules followed by crust. And doctor proceeded after confirming the same with her mother. He noticed child scratching the lesion. Doctor offered sanitizer to the child and he said that he will give medicine and she should not scratch. He found that there is no recent history of insect bite or trauma or skin disease. On asking if she had seen anyone with skin disease, she said few of her classmates have and they are not attending classes since then. On examination, honey-colored crust is seen over part of the nose and cheek on the right side of the face, and on elevating the crust, there is moist erythematous base, and fresh exudate is collected with swab. The neck showed submandibular lymphadenopathy. Doctor informed the same to attender and said it will resolve with the infection. He also took swab from the patient's anterior nares, and both the swabs are sent for staining and culture sensitivity. Doctor is suspecting patient has impetigo contagiosa, also called non-bullous type of impetigo. Let us discuss pathogenesis. Trauma to the skin reveals fibronectin receptors which facilitate colonization of bacteria. Let us distinguish between types of impetigo. We have two variants, bullous type and non-bullous type. Trauma history is usually present in non-bullous but not in bullous. Non-bullous is most common. Organisms isolated are Staphylococcus in bullous, whereas it can be Streptococcus along with Staphylococcus in non-bullous. Bullous type presents with pressile thin bullae, whereas non-bullous present with macular rash followed by pustules or vesicles which burst open to form honey-colored crust. Systemic symptoms like fever, diarrhea are usually present in bullous type. Regional lymphadenopathy is usually present in non-bullous type. Buccal mucosa is usually not involved in non-bullous type. Impetigo is mediated by exfoliative toxin A, B and D. So one of the complications is Staphylococcal scalded skin syndrome. The pop-up is to your right top corner and you can get a quick glance on syndrome. We can treat our patient by applying mupirocin 2% to the lesions as well as nostrils. Since there is an outbreak in the school, we can add oral cephalexin. Add desloratadine to relieve itching. Indications for oral antibiotic therapy, widespread lesions, outbreaks. If you are suspecting community-acquired methicillin-resistant Staphylococcus aureus, trimethoprim sulfamethoxazole can be tried. Prescribe an antibiotic soap to wash the lesion before applying the ointment. If no improvement with mupirocin, ritaformalin 1% will do the trick. Following advice has to be given. Wash face gently with antibiotic soap and remove crust slowly. After that, apply cream on the lesion. No school for 2 days of therapy. No scratching. If scratched, wash hands. Avoid direct contact as much as possible. All the members of the household should apply cream to their nostrils and to the area of trauma. Nails should be kept short and clean. Wash hands often. Keep the surroundings clean. How would you manage if the same case scenario comes to your OPD? So here comes the social message. First to school authorities. Implement screening programs in your school. Identify the children with health problem early. Let me tell you my story. Back then I was 8 years old and my parents noticed me watching my favorite show. Here comes the Power Rangers, here comes the Power Rangers, here comes the Power Rangers Mystic Force. Very near to television. They pull me back only to see me near 5 minutes after. Thanks to Power Rangers Mystic Force and my family, I was diagnosed with myopia and anisometropia with power of one eye minus 1.75 and the other minus 2. I don't remember how bright was world and I thought everyone saw like me. Now I got LASIK done 2 years back and trust me, I only came to know how sharp an object can look and how bright it can be only after 20 years of blur. So, implement health screening programs in your school, identify diseases, intervene and make your children healthy. To parents, school is not a place that shows 98% in languages and 99.9% in groups on marks card of your child. It is all-round development that matters. It should have multiple events planned in its schedule and implement the same to develop your child physically, mentally, emotionally, socially, and you can add such infinitely. And all this should happen and your child should enjoy. He or she should cry for not going to school. One of the factors you should take in criteria for the best school for your best buddy is health screening program. It all depends on you parents. You choose the best and the rest emerge as best. To child, no need, you won't watch this video at all. It's not for kids. So comment, share to spread the message, like and subscribe for notifications on my recent videos. Thank you.